button up here near the top that looks like a folder opening to open the patient's chart. Now, when you get the patient's chart open, if it said you have lab results, you're going to want to click on lab to look at all the old lab results. And by default, it just shows you one particular lab. I guess it's the most recent. If you want to see the patient's entire lab history, you click all over here, and you can scroll down to see all the labs they've ever had done. Now, if you want to look to see if they've had a specific kind of lab done, you can go to select order, find that specific lab type, and it will show that as there as well. But you're looking for the ones that haven't been reviewed, and so usually they'll be the ones at the top in the all view, and you'll want to go through and review them. Now, in order to review labs, the best way to do it is to click this list non-reviewed diagnostic tests only, and it'll bring one set of labs up at a time, and as you look at them and review them, they go away from this view. So I'm looking at this patient's looks like a CBC, and then I want to mark it as reviewed. I click this, and it asks you, are you sure? And you click OK, and then it gets rid of that, and it shows you the next, which is, in this case, looks like the manual diff from the same CBC. Okay, I've reviewed that, and now it's showing me your analysis. You keep on going, and it will continue to show you unreviewed labs until there aren't any more. Now, I'm going to uncheck that. Go back to showing all the labs. Another helpful thing that you can do on the lab screen is when you're looking at a certain lab, you can double click that lab. Let me show you a different one here. And it will show you that particular lab value's entire history. Now, this is a little bit different from bringing up a lab from here, because say there's a lipid panel. Well, it'll only show you all the lipid panels, but if you just want to see the LDLs from the lipid panels, you can double click the LDL and it'll show you all the LDLs. In this case, there's just one, so there's just one in the list. Now, that's about it as far as reviewing labs go. If your message had said you have clinical documents to review, then you'll need to go to the patient's result viewer, and that's always on the main tree that shows up first when you open the patient's chart. This is the result viewer. It's a separate, almost like a separate program from the main one, although I guess you just call it a sub-program. Now, when you open the result viewer, the specific document that's in here that they're wanting you to look at is going to have a question mark beside it, beside its tab. Now, if there are other old things in the patient's result viewer that haven't ever been marked as reviewed, then they're going to show up with question marks too. But if you'll keep your patient's result viewer charts up to date and everything reviewed as either normal or abnormal or severe, then the only question mark that will be there will be the one that's new, and that'll be really helpful and keep you from having to search through every tab to find the newest record that may be the one they were talking about. And so let's just say that this abnormal pap smear was the one that they wanted us to review. I don't know why these others are not showing up anything inside them, but anyways, what you'll do is you'll find the thing that's unreviewed, which it'll be in white. You'll double click it. You'll open up the actual pap smear, which in this case just says testing because it's a Mickey Mouse chart. But if it were a real pap smear, you'd look at it, and it's, let's say it was normal. You'll click the reviewed button. You'll leave this as normal, and type a little note. In this case, I'll just type normal pap, and let's say it was collected on 4/11. That way, when I close it, the next guy that comes along is going to see what I just typed, reviewed by me on such and such date. What it was a normal pap on 4/11/08. I'm sorry, I should have said abnormal because somebody put in abnormal here, but you see that whatever you type here is going to be seen by somebody else. That's really helpful because it prevents them from having to actually open the document to see what it was. If you can just put in the pertinent information in the little review note, it'll be really helpful for yourself or whoever comes along behind you. So that's it. If you've got a letter from a consultant that's just kind of telling you what's going on with the patient and you don't really want to label it normal, abnormal, severe, you can always just put reviewed as unknown, and it won't be any of the three, and it'll just stay in white, but it won't have the question mark beside it as though it needs to be reviewed. That's pretty much it on the result viewer as far as reviewing labs. While we're here, I'll just give you a quick way to look at the patient's old vitals. Keep in mind that the result viewer only shows by default the information from the last year. If you've got an old echo or something from 3 years ago that you want to try to dig up, or if you just want to see what they've had overall and get it to show you everything, you're going to need to go up here and increase this number and click refresh, and then it'll show all the old stuff. And in this case, you see now that Mickey Mouse has vitals entered in from way back, but it only showed us one because there's only been vitals entered in Mickey's chart once in the past year. So that can be helpful also. Usually you need to just go back as many years as it takes to get back to around 2003 or 4, because that's when we started using MedInformatix to begin with. So keep that in mind also. Another quick tip on the result viewer before I leave it is for weight and height growth charts on kids. If you'll just click here in the first weight box and drag down and select both of them and then click open, it'll bring up a chart. And this is an adult, so it doesn't show it exactly the way that it would in a child, but if this were a child's chart, you'd see the growth curves like you're used to seeing in printouts and doctors' charts. That's it for the result viewer also. So we've covered how to look up labs and look up clinical documents if you get one of these messages. When you get done with that, or let's say you got a message from a nurse saying please call the patient because they want to know this or that, or whatever your message is, when you've handled that message and you want it to go away, you highlight it and you click viewed. Now for me, let me just check this box here and I'll tell you what it means in a second. For me, when I click viewed on a message, let's see, the Mickey Mouse chart is the one I wanted to click viewed on. When I click it, it goes away. By default, when you click it, it'll turn green, and it'll go away after 24 hours. Well, not after 24 hours, but on the next day at midnight that night, it'll go away forever. Now, if you want them to go away forever immediately when you click view, you can just uncheck this box that says show items marked viewed today, and then as you go through and you click viewed on messages, they'll just go away. And so that's about it on checking messages. We'll see you next time. This is the MedInformatix tutorial, the lesson on navigating a patient's chart and gathering information. We're on the patient list view, which you can get to by clicking the patient list button, and we're going to look at one of the fake charts. We'll look at Minnie's chart this time, one of the Minnie Mouses. And we'll select her, and in this view it's better to just single click and then click this button to open the chart. If you double click the patient's name, sometimes this thing just disappears. I'll show you. It just goes away instead of opening it up. It's kind of a little bug in the system. So when she's highlighted, select this button and that'll actually open her chart. Now this is what a chart looks like when you first open it, and we're just going to talk about some of the things that you'll do to gather information on a patient by looking through their chart. First of all, you can see their principal doctor on the clipboard view. You can see this right hand side looks like a clipboard. You might think that you could click on these buttons, alerts and vitals, and have them do something, but they don't. At the top here on the actual page, you see principal doctor, and if somebody doesn't have a doctor assigned, for some reason by default it says 01. So let's change this on Minnie. You'll never have to actually assign a doctor to somebody, but I don't want to say 01. I want you to see that they can be assigned to actual people. And so let's assign Minnie to Dr. Co. Save that. Doesn't show up, we'll exit out and then open her up again. And now she's assigned to the